elderly can also receive the vaccinations, administering any chronic illnesses they might have. Moving forward to the impact. COVID-19 protocol is followed. No masks, no entry. Registering at entry points allows follow-ups to be done, and patients traced if possible and alarmed. This is now as from it started. Gatherings were monitored, curfews were in place, alcohol sales were monitored, shebeens, nightclubs, night shops are monitored, lockdowns were initiated in regions where cases escalated. Flights are monitored. You need to take a COVID-19 test to be taken before traveling via road or air. Schools practices social distancing, operating face-to-face learning with 2 groups, 1 week, group 1, and second week, group 2. Just a second, please. I was also following the guide that was sent to us, why we chose child mobilization. Our main focus is child participation as is set out in our Child Care and Protection Act. Namibia has many policies in place, but I want to state what my previous colleague was saying. It is tough. The policies are there, but they are not implemented. So our child participate is children of sufficient age, maturity, and stage of development must be given a choice. Children's view should be given an appropriate degree of consideration, keeping in mind the child's age and maturity. This is important because children have thoughts and feelings. They should not be treated like objects to be argued over. However, activities for 2021, mobilization in grooming of children of age to speak in public. This is the activities that we were performing as training with us, having our children as part and parcel of the program, raising and grooming, training children on volunteerism, literacy learning initiative, how they should use social media, a new program that came out that I was currently busy with in the implementation system, that was eradication. When cases are holders case and rated and signed, implementing a phase where we were recruiting members of other regions. We wanted to emphasize police clearance certificates in place for members that deals with children. So the safeguarding protocol needs to be in place, and we emphasize that they need to go and take that police clearance in order for them not to be have criminal activities, because that is readily caught up when you go to police. And when you have your police clearance, everything is the government, and make sure that all of these children are under the protection of the law. Children's rights, however, in reality, it often seems as if adults enjoy this protection. This may be attributable to the following factors. Children do not know their rights. The protection system, policing, and legal system is not child-friendly. Society is quick to stigmatize any child who wants to ensure that he or she has rights and that they should be recognized. We do struggle with some cultural and practices that are hostile to children. There's a lack of information available on the rights of the child. The protection of children is applied selectively. The preamble further states that in areas whereas the said rights include the right of the individual to life, liberty, and the pursuit of happiness, regardless of race, color, ethnicity, origin, sex, religion, creed, social or economic status. Therefore, again, emphasizing our key child participation is key. We do have another active activity that one of our members, Lifeline Childline, has initiated the School Readiness Initiative. And most of our members is part of, it is in collaboration with Ministry of Education and Ministry of Gender to all ECDs and primary schools. And most of our members are beneficiaries of this project to ensure that all our children are well prepared and ready for primary school. This initiative strengthens the efforts toward making sure all children attend primary school. Counseling services are on and off-site are offered to individuals as well as group counseling suffering the pandemic from Lifeline Childline. We want to collaborate with countries, South Africa and all our neighboring countries. Namibia needs to learn. We need to learn from best practices, and we need to also share our ideas with everybody. The assistance that we would need from Crnsa is to strengthen the CSO engagement through capacity building training, best practices, learn more and more from other countries, strengthening our commitment as members with Crnsa through active participation as a country. In conclusion, I'd like to say again, expressing our gratitude for being part of this platform, for being here just to sit and listening, hearing how other countries are expressing what they are going through. I'm very thankful for that. And this is greetings from Namibia. Thank you so much to Sami.
Quite elaborative, and thank you for your time and your presentation.
Thank you.
We have learned a lot from Namibia, and thank you so much for the presentation. I think according to our list, we will invite Malawi and then Mozambique.
Thank you so much, Chair. Can I share the screen?
Yes, please. Felicitas, please facilitate that.
Okay, done.
Okay, can you see my screen?
Yeah.
All right, thank you so much. Once again, welcome. This is Henry, National Coordinator for NGO Coalition on Child Rights in Malawi. Basically, as a coalition, we are a member network of NGOs and CSOs working on the child rights sector. And our vision is to see a society in which children's rights are promoted, respected, protected, and fulfilled. And we are pursuing a mission in which we would like to contribute towards the promotion, respect, protection, and fulfillment of children's rights through evidence-based advocacy, coordination among the CSO sector, capacity building, and research. What we do, we have 4 thematic areas, which include advocacy, coordination, capacity building, monitoring, and reporting. As regards to the update on COVID situation in Malawi, to date, since the inception, the onset of the pandemic, we have accumulated a cumulative figure of 34,284 cases that were confirmed. And this is coming from the tests, the accumulated test of 243,176. And out of the confirmed cases, 32,462 recovered, fully recovered. And currently we have 437 active cases. And in our health facilities, as of yesterday, we have 9 9 cases who are admitted. Who in this case, it means out of the 437, only 9 are admitted. The rest are minor or mild cases that are in homes. Unfortunately, cumulatively, we have lost 1,153 people to COVID. In terms of vaccination, to date, Malawi has vaccinated 344,647 people in the first jab. As regards to achievements for NGO CCR and 2020, we had a number of partners who we worked with, who supported our work as a coalition. We have Save the Children International Malawi office through NORAD SCRAPE framework. This is Save the Children is our strategic partner. It's a long-term partner for Malawi as a coalition of child rights. We worked with, we had support from Crnsa. Apologies for the spelling, I'll edit. Crnsa, we worked on together on the CSO forum, activities around the new strategic plan, but also the charter at 30. We also had support from Crnsa Marshall Trust on the issue on activities related to children complaints or child rights complaints handling, a mechanism under the ASA week, but also we had an engagement, a dialogue session with intergenerational leaders with girls. So we had that support from GMT. With Subsidy supported us on training for CSOs and the high-level engagement on child-friendly budgeting. So we had support from Subsidy. We also had support from International Budget Partnership, who identified us as a national researcher, NGOs instead of being a national researcher, for open budget survey for 2020-21. For starting with the COVID survey, which was done last year in December, and we participated in the assessment under this mechanism. But also worked with the FID program in Malawi that is focusing on ending child marriages and also ending violence against girls and women. So that was, we worked on this in response to COVID. In terms of our key intervention on the COVID, we, as a coalition, we had an assessment, a rapid assessment to establish the impact of COVID on children, and also how the government was responding to COVID pandemic with focus on children. And also, as I said, with in partnership with DFID program, we conducted dialogue sessions on children and youth-friendly services in 3 districts, but also we disseminated a community awareness handbook on gender and child-related laws to communities, in addition to the OBS survey. Another area which we achieved is on the treaty reporting mechanisms. As a coalition, we lead in the CSO sector and complement the Malawi government was being reviewed to the ASA week. As such, NGO CCR led CSOs in the children's sector and also children themselves to document the periodic reports, child-informed for the CSOs, but also child-led for the children report. But also we followed up, we monitored and tracked progress in terms of implementation of the previous concluding observations on the UNCRC, but also the African Charter and the UPR reporting mechanisms. Malawi, as we all know, we facilitated a joint implementation framework for the these reporting mechanisms. So we were monitoring and tracking progress of implementation. As I indicated, we facilitated and supported children to document their own report to the African Committee of Experts on the Rights and Welfare of the Child. Unfortunately, because the state missed its reporting schedule, the government was not able to document and submit the state party periodic report to the ASA week. As such, our report, our complementary report and the children's report have not been submitted. We have just kept them. We are working with the government to lobby and try to push that the government should first track documentation of its report and submissions so that we can also submit our report and also the children's report to the ASA week. Another area which we did as NGO CCR is influencing investment in the children. This is one of the key areas for coalition. And over in 2020, we engaged the national. We engaged authorities in the national budget processes. We conducted budget analysis. We conducted lobbying meetings and engagements. We participated in the pre-budget consultations, but also the cluster session of Parliament, and also the public budget hearing sessions. We made the presentations and also we engaged. We also engaged the private sector on the child rights and business concept, to the principles, and also and we made follow-ups to the companies on that regard. We also, another area, on capacity building, we involved and facilitated some advocacy planning and implementation strategies at district level, where we have district CSO networks, and we supported 3 district CSO networks with the advocacy and also advocacy planning and implementation. Another area where we implemented or achieved is influencing for child participation at national and district levels. Under this, we supported, of course, in partnership with other players, the Malawi Human Rights Commission and Save the Children Malawi. We supported the Ministry of Education to develop a student council handbook. This is an initiative to promote participation of children in schools in terms of decision making. So there was need to develop a national guideline for that. We also, as NGO CCR, we supported the Ministry of Gender that is responsible for children issues in the country to develop a national child participation guidelines. And we supported them by seconding a consultant, but also supporting the national task force that was leading the process. Again, we facilitated participation of children in various forums, SADC, but also Africa level. We had children activities like the Africa at the Charter at 30, the reflection of impact of COVID on children, child protection compliance mechanisms, intergenerational dialogue, the 2020 Africa Child Forum session, but also documentation of the complementary report, child complementary report. Another area, we engaged the media, especially on child-friendly reporting on various issues and violations against children. And also we had a number of media statements on position where we had various positions on related various issues related to child violation cases or instances. And as indicated, child rights and business is also one of the key issues. So we had a number of engagements with private sector companies. Just to comment on the issues that children have included in their report last week, the children of Malawi have isolated 6 issues that they want to communicate to the African community of experts. These 6 issues include child marriages, access to education, discrimination and child participation, property grabbing, access to health, and child protection. So these are the key issues contained in the child-led complementary report to the ASA Week. Again, during the engagement on influencing child-friendly budgeting, when we had a budget analysis, we isolated 7 key issues, which we analyzed, identified key issues, and we engaged the authorities on these issues. And these issues included child protection, social protection, early childhood development, basic education, nutrition, child labor, and birth registration. Last year, NGO Coalition on Child Rights hosted our colleagues from Rwanda Coalition on Child Rights in around December. So we hosted them. They were able to engage with our member organizations, but also the children parliament. They met one of the district councils to learn how they collaborate with children and how they incorporate decisions and recommendations from the views from children, the parliament, and also they engaged and interacted with the Ministry of Gender, the Directorate of Children, and also the Parliament, Malawi Parliament, on how it incorporates ideas and views from the children through children parliaments. Key challenges, one related to COVID. One is the closure of schools as a result of COVID pandemic, and this led to loss of education opportunities for children. And also with that closure of schools, Malawi registered a high number of teenage pregnancies, and also the child marriages, where over 40,000 girls got married within 5 years after closure of schools. Also 13,000 girls or children got married during the same period. And we witnessed a loss of jobs and businesses for caregivers, and this led to incapacitation of primary caregivers to children, that the parents and guardians that could not be able to provide for the basic needs of children. The general challenges include a COVID pandemic, the delay in finalization of harmonized child-related laws on age of the child. As we all know, Malawi amended its constitution in 2017 to redefine the child and align with the provisions of the Charter and also the CRC. So that led to a gap where other related laws, like for example, the Child Care Protection and Justice Act, the Penal Code, still recognize a child as someone below the age of 16, not 18. And this has a challenge in terms of access to justice, especially on sexual-related offenses, where issues of deferment is still being recognized as a case where a girl below the age of 16 has been sexually abused and not below the age of 18. So there is a process of harmonizing the other laws so that they comply with the amended section. And this process has not been finalized, and this is a challenge to the promotion of access to justice for children in Malawi. Another challenge is on failure by government to submit the periodic report to the ASA Week. This led to us not submitting our reports because ours are complementary. We need to have the state submit its report and then submit ours. Another area as a challenge is the uptake of our advocacy issues by the government. There is still a slow pace at which the government is adopting the issues related to investment in children, issues of policy implementation, and systems that can protect the child in Malawi. So this is work ongoing. We are going to continue engaging the state to make sure that we see some significant movement in terms of aligning the IPF towards protecting the child in Malawi. Looking forward into 2021, key activities include the treaty reporting mechanisms, where we are focusing on popularization of the recommendations from the UPR. We also want to develop a joint implementation framework for the UPR recommendations. We want to support the government to document its state report to the ASA week, and also continue following up and tracking implementation of the previous recommendations. Again, on the legal and policy framework, we are going to continue supporting rolling out of the finalization and rolling out of the handbook, Student Council handbook, and also the National Child Participation Guidelines. In terms of investment in children, we are going to continue to participate in the budget, national budget processes, and also the strengthening the CSO caucus on public finance for children, and also participating in the national researcher, participating in the OBS, Open Budget Survey for Malawi for the previous fiscal years. Just to indicate that for Malawi, what we do during the budgeting processes, as a sector, we don't normally hire a consultant. We use the capacity from within the sector. So we identify people and identify issues to be analyzed in the national budget, and we have a consolidated report, and we make presentation and with the policy holders. Again, on child rights and business, we're going to continue with engagement with the private sector companies on the concept, and also following up on those that are maybe at the level of developing child safeguarding policies, child protection policies within their companies. We're going to continue engaging the media, but also the child participation aspect. The kind of support from Crnsa, number one, our strategic plan expired last year, and we're in the process of developing a new one. And there, I think we are going to engage Crnsa for support, technical support and other related support. And also, we are going to, we look up to Crnsa to get support in terms of influencing the state to comply with the treaty reporting timelines. We hope that at the Crnsa level, we can get that support to push. We are pushing at national level, but also I think we need a concerted support from Crnsa. Again, on the capacity strengthening for Parliament and other policy holders in child-friendly budgeting, and also child rights and business, we anticipate to get support from colleagues at Crnsa level who are doing well or maybe more advanced in these aspects. Otherwise, thank you so much. That's what I can share for now. Thank you, Chair.
Thank you. Quite elaborative. Can we just move on because of time? Mozambique, please come on board.
Hello, good afternoon. Hello,
yes, Nasiso.
Oh,
yeah, welcome, Nasiso. Long time.
Yes.
Come, my friend. Yes, welcome.
Yes, can please allow me to share my very short presentation?
Yeah, listeners, please.
Yes, MC, we are doing that.
Okay. Are you doing this?
I think it's coming. Felicitas, is it coming? Hello?
Yes, it's coming, MC. Please go ahead and share. We've enabled you.
Share, please. Nasinso, please go ahead and share.
Okay. Just a second. Can you see it? Hello?
Yeah, you can see it now.
Oh, fine. Okay,
Yes, we
thank
can see
you
it. Go
very
ahead.
much. Yes,
ahead.
thank you very much. And, good afternoon. I'll just briefly say that what Reda Crnsa has done in Mozambique, together with other stakeholders that we work together in the area of child's rights, we started with the mapping and documentation of evidence on good practice and challenges for the protection and safeguarding of children in public and private business sector. That has to be, do with the children's right and business principles. So this is something that has started. We are continuing to do this. We will be having the report somewhere in September. I hope that by that time we can share it with the Crnsa members. We also managed to work on the Uber review, writing the CSO focused child focused report that was submitted in the 58th section of the UN in October. So we are happy also that we have now received the recommendation on this UPR review. We also promoted the voice of children during the COVID time by helping or supporting children to write an annual report. This is a new initiative in Mozambique. This report was not meant to be sent to any of the treaty body committees, but it's a national report. How we did this, it was very, very interesting. We worked with one of the child who is the chairperson of the National Child Parliament. We provided them with the credit to have the airtime in order to consult with different children that at least had access to online. They had the smartphones that could be sending messages on their opinion according to what they think about their right, how their rights were violated, or how they are happy or not with those. And this report is already finished. It will be shared, the English version. What we have now is Portuguese. That's why I can't say it there. But we are going to put it on our website. We also popularized the main legal instruments aligned with the rights of the child in a language that is accessible to children and the ordinary people. So we came up with some leaflet on the African Charter and on the UN Convention. We produced there about 1,000 of leaflet with a very, very accessible language on the message that are in those articles of those instruments. Also, we held a social forum to celebrate the 30 years of the African Charter. This was a television program where different stakeholders and organizations, including children, participated, and they talked about what they think, what is their feel in relation to how the rights of children are being implemented in Mozambique, especially in the African context. We also had awareness activities. One of the major awareness activity was on the June 12th, the International Day Against Child Labor. One of the things that we saw in Mozambique during this COVID period, although some schools were closed and almost people were not allowed to move at anyhow, in the rural areas, especially in the small village, you could see some children working for some business people and other kind of situation. So we thought it's a good way to sensitize people and the children themselves. We knew that some of these children, they had to work due to lack of food and different things, because most of the parents and other business activities had to reduce due to COVID and all. We also produced and spread YAC material with the messages on protection of children against COVID. So this is what we did. So what is under course now, we are producing a guide, a child participation guide, and because I had Eswatini, we welcome Eswatini to work together. I had the presentation saying that it would be a good idea to share experience on the child participation. So now we are developing a guide on child participation. This will include the tools on how to track monitoring of public policies, legislation, and the recommendation of the National Child Parliament, the recommendation of the UN Committee and the African Committee of Experts. Also, we want to engage the government in order to ratify the third protocol, the protocol on the procedure about reporting a child violation of child's rights in Mozambique. Mozambique has not yet ratified this, and we want to push so that it can be ratified. This will allow more effectiveness in terms of access to justice by children. Also, we want to have to exchange our experience on report writing to the body treaty, especially on the African process with Angola. This is our suggestion. We don't have exactly the dates, but we are going to liaise with Angola so that we can have our experience and learn from them, and also we believe will be learning from us. Okay, we also this year we are going to support children again, and this will be also to consolidate the experience of the last year on writing the second annual report. We also do mapping of the needs of CSO on knowledge of public planning, process, decision-making, child protection, and safeguarding, including case management. This will include also the child budget analysis. Now that I learned from here that Malawi could be one of the countries that we can work together. We will see how to deal with this. We may approach Malawi to have somebody coming down here to Maputo and be one of the trainer, because we are planning to train our staff, some of our staff here at the Red Crnsa and other CSO that are working on children's rights, and they work together with Red Crnsa. And that is all. Thank you very much.
Thank you. Thank you, Narcissa. Felicitas, can we go ahead and invite Zambia?
Yes, let's go ahead and invite them. And maybe finalize, if they are not long, we can take Zambia and Zimbabwe ones so that we can let people go for lunch after that.
Yeah, otherwise it's way after lunch now. Yeah, please. Zambia and Zimbabwe, please. You are the last two.
Hello, thank you so much. Could you allow me to share my presentation, please?
Hello.
Yes, Jofat.
All right, thank you.
Doing that.
Hello.
Hello.
Yeah, can you see my presentation?
Yes, we can.
Yes, Josephat.
Yes. Yes.
Right. Thank you so much. Thank you, everybody. Thank you, Chair, for allowing us to present. This is Josephat Njovu, representing National Child Rights Forum Zambia. I will try by all means to be as quick as possible. My focus is so much on 2021 in terms of the main activities that we'll be doing as National Child Rights Forum. Of course, I will be touching a bit from the past activities that we've done. So, but for starters, just to let you know that my focus will be more on the main activities, main advocacy activities that we'll be looking at in 2021. So, firstly, of course, I would love to talk about NCRIF, of course, National Child Rights Forum Zambia, who we are and what capacity do we have and what do we do and what problems are we addressing and the differences do we want to, and the difference that we want to see or make in our country. So the National Child Rights Forum consists of executive directors from organizations that foster children's rights, upholding the general principles of non-discrimination according to Article 2 of the Charter, and best interest of the child according to Article 3, and the right to life, survival and development according to Article 6, respect for the views of the child, that is according to Article number 12. These members have different capacities on addressing children's issues and situations. And they play the governance role and coordination alternatives every after 2 years, or to alternate. So that's a Child Rights Forum. And of course, you also heard from one of our members from Zambia Civic Education, Ms. Mlenga. She mentioned about the fact that they are the initiators of the child rights clubs actually in Zambia, and those are the strengths that we have in National Child Rights Forum. So National Child Rights Forum initiates initiative in Zambia has 5 thematic groups led by members, organizations that aim to foster improved child rights, understanding and upholding by both rights holders and the duty bearers at all levels. So the first one we have is child protection, which addresses specific issues related to child protection and child rights in Zambia, ensuring an effective activity implementation in its specialized protection area. We also have the public budgeting for children, addressing specific issues around financial allocations to children's issues in Zambia, budget tracking, and we input also proposals to national budgets. And this actually sits with one of the members, Zambia Civic Education, that actually spearhead this child budgeting. We also have a child participation, and it fosters the participation of children at all forums that affect them by advocating for laws that support such. Capacity building, this team works towards enhancing capacity of member organization and the nations on the child rights. So, and then we also have the child delivery service, enhancing service delivery to children that includes education, health, and social welfare, etc. So now to just look at the 2021 activities that we are focusing on as National Child Rights Forum. Of course, as Zambia, we've taken measures to that we hope to give effect to the provision of the Charter and treaty-based ratifications, and also the promotion and enjoyment of the children's rights in Zambia. So in 2020, November, National Child Rights Forum submitted a list of issues under the simplified reporting procedure for UN Committee on the rights of the children. This procedure has a different timetable to the previous practice, the usual one that we've always participated in. And it creates new avenues for civil societies to use the reporting process for advocacy. So Zambia decided that they would actually use this reporting new procedure, which actually was due last year. And Zambia did respond to the issues that were raised by the National Child Rights Forum. Now, one of the significant new elements in this procedure is that it actually allows the preparation of list of issues by civil society, to which forms as questions that the government will be able to respond to. So in this regard, National Child Rights Forum submitted its list of issues, and Zambia government was due to submit the report on the 15th of February 2021, of which we've been reported to, or we've been told that Zambia did respond to. We're yet to have that confirmed. And we hope that we can hear what the Zambian government responded to the issues that we raised on various matters concerning child rights in Zambia. So the process is ongoing, and the NCRF has planned to participate in the forthcoming pre-session later on in this year. And this will result in the committee obtaining key child rights matters that to later in the year, of course, engage the government delegation from Zambia. And of course, Zambia also is due to report under the normal procedure reporting in 2022 next year. But then this time around, we're looking at the simplified reporting procedure. And in September this year, we are going to have a pre-session. And this is also another opportunity for NCRF and civil society to engage the committee, as well as also mobilize other members or other organizations to collaboratively look at the issues that we are facing regarding the child rights in Zambia. So further, we also have the African Charter and its implementation, and National Child Rights Forum also submit shadow reports. Of course, we did submit shadow report in 2018, which report actually was submitted by to the SOR committee. The committee received it, and also Zambia was due in 2018 to submit its initial state party report, which I think we worked very closely with them also during the presentation of the report in Addis Ababa. And then, of course, we did receive concluding observations that came to Zambia in 2019. Now, these are our focus for this year as National Child Rights Forum, to make sure that we follow through and see that the government is actually implementing the concluding observations as received from the SOWAC, the committee that actually looked at and received the initial report from Zambia. So as National Child Rights Forum, we continue to disseminate the concluding observations and recommendations from 2019, especially this week. We have a particular interest in making sure that the 2019 concluding observations and recommendations are disseminated with senior government officials, as well as the civil society and the community at large, to make sure that there is follow-up in terms of implementation in our country. So we've continued to plan to engage and collaborate to implement the African Charter in Zambia. So the other work that we have as National Child Rights Forum in terms of collaborative work is the fact that the National Child Rights Forum has always been dealing with the usual lack of political will by the state to prioritize issues of children in our country, as evidenced by the fact that we've had the Children Code Bill, which we think once that enacted, we will actually address a number of issues, and then also it tries to align most of the provisions to the international accepted standards. So this code bill has not seen the light of day for the past 16 years, and which is a worry. And NCRF, according to its mandate, it is our baby, and we have to make sure that this child code bill is enacted into law, and by engaging government and then so making sure that the government takes responsibility to make sure that they attend to the issues of children in our country. And then also we see that the child code bill will actually address issues to do with for example, the definition of the child, which I think previously it was our cry as a nation to make sure that we have the definition of a child harmonized. Of course, we saw it that in the Constitution, it does now the new Constitution, which was enacted in amended in 2016. It does align the definition of a child to the internationally accepted standards. But other pieces of legislation as related to children, they define the child so differently. So we see it now that in the Child Code Bill, this issue is being addressed, as the Child Code Bill does refer the definition of a child to the Constitution, and which actually harmonizes effectively, harmonizes the definition of a child in Zambia. And we also see that the bill itself increases the criminal responsibility of the child to 14, as opposed to the 8 years, which is actually obtaining in the current statutes in our country. So we hope that the Child Code Bill can be enacted into law, and those are other issues, as long as many other issues that raise a lot of concern in our country. And just for your own information, you would also want to know that the Child Code Bill is an amalgamation of different pieces of legislation, which actually brings together all child-related legislation, including the Juvenile Act, or what we can call the Administration of Child Justice in Zambia. And we also have an Adoption Act, Affiliation and Maintenance Act, Probation of Offenders, and Legitimacy Act. So it's a combination, an amalgamation of different pieces of registration, which actually will work very well if we have all these pieces of registration codified in one statute, to help to deal with the harmonization of that definitions and all these other cases that focus on children matters. So NCIF will also have a series of engagement through media, courtesy call to political leaders and other avenues. As you can see that you may be aware that Zambia is going to the polls this year. And of course, a number of political parties have actually come out and disseminated and shared their manifestos that they would love to see that Zambians buy into, and then also make sure that they are voted. So we are taking this opportunity as NCRF also to engage the political leaders to make sure that their manifestos also they carry the the child rights messages, or focus on issues that will bring development in as far as child rights is concerned in Zambia. So our agenda as NCRF is to make sure that the political parties they have to align their manifestos with the African Agenda 2040. So we are working on this, and we'll make sure that this year we organize series of engagements and series of meetings, and probably also the media statements, so that we get the message across to the political leaders and see that as they are planning to form government, they are also thinking of the African Agenda 2040 and how they will actually address the issues to do with children in Zambia. So NCRF also continues to engage lawmakers such as parliamentarian caucuses on children, the committees that are mandated with children matters, and various government ministries dealing with specific thematic areas of children's rights in Zambia. So we also, as NCRF, to support this, the participation of children, we have a number of activities, as I also shared from the thematic groups that form the core business of NCRF. We have the pillar that actually looks at the participation of children. So for this year, we are actually looking at we did last year in 2020 we conducted public hearings to foster child participation and respect for the views of children by providing platforms for assessing children's understanding of their rights and responsibilities, as well as for them to express their views on matters of their children. So we don't want to have children voices a mere appendage, but we want the children voices to be part and parcel of the development of Zambia, and development of any issue or a development of any rights concerning children. The children must be part and parcel of what is going on. So we conducted public hearings in 5 provinces last year. And this year also we're focusing 5 provinces to make sure that we conduct the public hearings where children come together. We give them a platform for them to come and express themselves, and then also using it as an assessment for us to see how we can devise and design more programs that will promote child participation in our country. So in 2020 also, 2020 we conducted 5, and then also this year we are going to conduct 5 public hearings that will make 10 public hearings in all the 10 provinces. So we also look at of course the impact of the COVID-19, which cannot be overemphasized. COVID-19 worldwide, we've seen that it has had a very devastating effect and disruptive. And Zambia has recorded 93,201 cases, 156 recovered, and 1,260 deaths. So these are some of the COVID-19 effects that we've had. And of course, as organizations in our country, in Zambia, have negatively been affected in terms of implementation, as well as, of course, some of the organizations have been affected in terms of the funding. Of course, funding has also gone down, which affects the programming. And then also we see that that's effect in terms of what the NCRF can do in terms of its plan. Then we've seen that the observation of protocol also has been, in terms of activity implementation, it has actually a negative effect, because some of the programs that were supposed to be done within this stated period of time, they could not be, because of the observation, the numbers, the limit in terms of the gatherings and traveling and all that. So that had a devastating effect. But then, of course, as NGOs and members, we had to come up with COVID programs and activities that are COVID adaptive, so that it doesn't negatively or adversely affect the implementation. So that has been done. Most of the members have observed that. We've seen that in the budgets. Of course, we are now bringing in issues to do with buying of protective materials, and then also making sure that also we are sensitizing the public and about COVID-19, raising awareness in the communities, schools, churches, and places where children are found. Of course, we also talked about the responsive programs that will address the issues of child abuse, school dropouts as a result of COVID-19. So thank you so much. This was my short presentation, and I hope that you enjoyed it. Thank you.
Thank you. Maybe not very short, but let's go ahead and invite Zimbabwe as the last presentation.
Thank you.
Zimbabwe, please. Zimbabwe, the floor is yours.
Hello.
Hello.
Can you hear me?
Yes, we can hear you.
Thank you.
Josephat, you can stop sharing.
Hello. Please go ahead. Yes, ma'am.
Hello, can you hear me now? Thank you. May I say good afternoon to all colleagues and all protocol observed. I'll just go straight into the presentation. A detailed one on PowerPoint will come later. For now, I will just present as I have the notes with me. And I just want to say COVID has also impacted on a lot of children's issues in Zimbabwe, particularly in the area of education and also access to health, as well as access to justice. We've also seen an increase in cases of teen pregnancies. Hello, can you hear me? But the other colleagues, I don't hear them acknowledging.
No, we can hear you.
Can you can hear me?
Yes, sir, we can hear you.
Thank you. I was just talking about the challenges of COVID and how they've impacted on children, especially in the area of education, areas of access to health, access to justice, access to birth registration, where government offices have, most of them have closed and have limited staff working. So this has really affected child programming. We've also seen an increase in child pregnancies. In 2020, 5,000 girls got pregnant in that year. So this is also, in fact, they impacted on children in Zimbabwe. Also, the socio-economic and political environment has had its own impact on children, particularly where the currency was not stable for some time, but we've seen some stability going forward. There's also been the climate change issue, which has affected the country, particularly access to water and also food security, as people could not harvest. We've also had challenges in funding, particularly for the main network itself. Although we still have some funding partners like Charities Homes of Germany, we also have Plan International, we also have Save the Children, we also have SOS Children's Villages. We've also had, from Plan, there were 2 projects that were funded. Those were the main funders. The others would come in for activity-based support. We've also seen an increase in sexual abuse cases in our communities, which is very alarming in our case. And because of limited access to justice, some of these cases are taking long to conclude. We've also had challenges in trying to coordinate the network itself, because in COVID era, there were no public meetings that were happening. And even now, as we speak, they are limited to 50 participants per meeting. So it's still a limit. When during our peak, we could go up to 80, 100 participants in a given meeting. In what we also some achievements, we have seen child participation throughout our programming, particularly in the virtual meetings that we're holding, and also in the writing of the African Charter report for Zimbabwe. Children have actually come up with their own report. It is yet to be submitted to the African Charter, but we are at the design stage where we're just putting covers, but otherwise the report is ready. We have been able to do our annual conferences, but virtually. But children were involved to make sure that children were present throughout those meetings. So virtual meetings have been our main coordination mechanism in terms of the reach out to our members. But we've been also participating in other local networks, like the Women's Coalition, the Education Coalition, the Child Protection Working Groups, and also in Children on the Move, which we felt was very strategic at these networking meetings. We also were involved with the government in the last report. Zimbabwe's issue of coordination by government was discussed at the African Charter, and now government is coming up with a national child care implementation plan, and we've been part of that. What is left is to launch that plan. There is also a review of the national orphan care policy by government, and we are part of the technical working group. We are still to align laws to our Constitution of 2018, but we are also happy that the Education Amendment Act of 2020 has come into law, which abolishes corporal punishment in schools, which speaks to the second chance education for girls who fall pregnant. It also speaks to inclusivity in terms of children with disabilities. It also talks to schools that they need to ensure that there is alternative disciplinary policies in schools so that corporal punishment does not continue. We've also been involved. We still have other laws that are way to be aligned, but there's one under discussion, the Children's Amendment Bill, which used to be the Children's Act, and also a new bill, the Child Justice Bill, that deals with children in conflict with the laws. These laws are at a cabinet committee on legislation, so they're at a high level, whereafter they'll be presented to Parliament. We've also been involved in the Zimbabwe Human Rights Commission, which is trying to come up with a child-friendly human rights handbook guide. Currently, we're involved in the in the report writing of the CSO, the Child Rights Sector Complementary Report, the alternate report for the UN Convention on the Rights of the Child, and also on the Universal Periodic Report. So we have done the consultations. We are waiting now for the production of the report. And I think for Zimbabwe government, it was supposed to report in April 2021, but government is still also consulting. So we are not really behind with this report. We've also been involved in the launch of the child marriages costed implementation strategic plan, which was done by our Honorable Minister in just 2 weeks ago in the country. And as we, in coordination and networking meetings, have been affected by COVID. I've already spoken about it. Then going forward, we are looking forward to participating in the commemorations of the Day of the African Chapter and other commemorations that children. We are also going to have our usual annual Child Rights Conference for 2021, and our hope is that the lockdown would have been lifted, or the pandemic will be under control, that we are able to conduct that. But if not, it will just have to be virtual. So basically, I can say this is what is happening in Zimbabwe, and we also were able to work with SAPEST, and currently we are a parliamentary caucus on children's rights, which will be launched in the country. We were able to assist the caucus come up with a 3-year strategic plan, and so this is also happening. But as the network, our strategic plan came to an end in 2020, and we look forward to the participation of Crnsa in trying to come up with our own strategic plan 2021 to 2025. We are currently consulting on behalf of government on online child safety protection policy. Government is trying to come up with a policy to protect children online. So we are currently doing the consultation, and our hope is that before July, there will be a protection policy, online child safety protection policy in place. This is our report to Zimbabwe. I want to thank Crnsa for the support that they continue to provide, and also we look forward to the new strategic plan, particularly the fact that we look forward for the child rights protocol within SADC. This is something that we have been involved as a Crnsa member. Otherwise, thank you, Dumi, for providing the time for us to present our report. This is our brief. I hand it over. Back to you.
Thank you, Reverend. Colleagues, ladies and gentlemen, we are really running out of time. I'm not really sure if we'll be able to take questions. It's way after 2 o'clock. We haven't had lunch break. It's almost 2:30 now. I don't know. I need to be guided. For instance,
MC, I think let's give people time to go grab something, to eat, something like that, and then they can come back with their questions. Perhaps we give it 20 minutes instead of the 30 that we had initially planned for. Questions, comments, and answers, and then we move right into the next item. I'm not sure though in terms of time, if the AGM agrees, we can say that we go for lunch now, at 27 past, and then maybe come back at say at 10 to, so that we can then have 40 minutes of engagement. So I don't know if they would allow us to cut on their lunch break time or health break, because it's important that we finish earlier than later.
Yeah, I mean, it's really, yeah, it's really correct. I think we should just, maybe we should have encouraged people to grab lunch, whatever, but yeah, it's quite, let's quickly then go and grab something. I don't know what, but anyway, you know your situation better. And let's come back in the next 20 minutes.
Thank you.